I'm here today with Dr. Eileen Shannon. She's a PGY1 pharmacy practice resident at UW Health in Madison, Wisconsin. Thank you so much for joining me today.
It's my pleasure to be here.
Great, so we'll just jump right in. If you could start off and tell us a little bit about yourself and what got you interested in pharmacy from the beginning.
Sure, so I grew up in the Green Bay area and always had an interest in science when I was in high school. And because of my personality, I just like interacting with people. I always liked the idea of patient care. So my love of science and love of helping people came together. I kind of knew I wanted to be in the health sciences field of some sort. So when I went to college, I was trying to figure out if I wanted to practice medicine or practice pharmacy. Those were kind of the two on my differential. My older sister was doing the medical school pathway, so I had her as an example. But I had a really good experience. I was able to shadow a hospital pharmacist during my junior year of college, and I got to see her role within the hospital, but she also had this really unique niche where she was on a team of clinicians helping cystic fibrosis patients. So she was the token pharmacist, but there was also a geneticist and a family medicine and a social worker, and they would all go in and talk to these children about their specialty. So she would go in and talk to them about their medications and their side effects. And that's when I realized, I can have these great patient interactions. And then just doing a little bit more research about pharmacy school, I realized it really lined up with my academic interests. I was a chemistry major in college, and the classes I loved most were microbiology, biochemistry, organic chemistry, and those are really the building blocks of pharmacy. And so I knew I could get great patient interaction. It also lined up with my academic interests, and that's really what sealed the deal as far as pursuing pharmacy.
Very cool. Yeah. And once you decided on pharmacy, kind of what was your educational path up to the point you're at right now?
Sure. So I did my undergrad at the University of Notre Dame and got a bachelor's in chemistry there, and took a lot of bio electives along with that in order to satisfy pharmacy school requirements. I did ROTC when I was in college, and so once I graduated, I commissioned as an officer into the Air Force and served for 4 years down in Florida. And while I was working as a research scientist for the Air Force. And so during that time, I was able to obtain my master's degree in analytical chemistry. And but the whole time I knew I wanted to go to pharmacy school, but I did have to serve my commitment. And so I volunteered at the local pharmacy in my spare time during my last year in the military. And then once my commitment was up, I moved back to Wisconsin to start pharmacy school here at University of Wisconsin School of Pharmacy is where I completed my PharmD. And then I stayed on to do my residency at UW Health.
Very cool. You've had such a unique path. It was cool to hear about that.
Oh, yeah, thank you.
So what activities were you involved in once you got into pharmacy school that supplemented your education?
Sure. So I'll talk about three main activities that I was in pharmacy school. CPFI was the student organization that I really put my heart and soul into. I was involved in WSPS, but not as much as other students, but CPFI was where I really got involved. I started out as the first year class representative, and then moved into the vice presidential role my second year, and then took over as president during my third year. And that was really influential in my life because I was able to make really great interactions with faculty members and really good relationships with faculty members. When you work as a president of a student org, you work really closely with those faculty advisors. So I think that was helpful as far as my professional development. And it also really strengthened my ability to organize a team and manage a meeting, and because we would have weekly meetings and making those valuable to other students. And then it was also, it really honed my peer leadership skills. I think leadership in general is something we're all learning how to be better at, but peer leadership in particular is hard. And so any experience that you can have as a student with peer leadership, I think is really valuable, especially if you're interested in a residency program. So another program that I got involved in was MEDIC, and so I was involved at first through just volunteer opportunities or fulfilling COPS hours. I would volunteer at MEDIC clinics, and I just loved the opportunity and I wanted to get more involved, and so I volunteered to be on the MEDIC council, or I applied to be on the MEDIC council, and I was selected to be one of their referrals coordinators.
Very nice.
And so that was a very valuable experience because we got to interact with School of Medicine students, so soon to be doctors, and I think that's just any kind of interprofessional education that you can get or interaction with other health professions is really important, because that's certainly how it is once you're a practicing pharmacist, so it's good to get those experiences as a pharmacy student.
Absolutely.
And then lastly, so this wasn't like a school activity, but I worked a lot during my pharmacy school. I worked at a bakery. That was more of like a hobby job that I had. I also worked as a technician at the Madison VA and transitioned into an internship role there. And that was really valuable, both from a clinical experience, but also just learning how to time manage, because I would work a lot of hours during the school year.
Absolutely. Very involved you were. And for some people who might not know, what does CPFI and WSPS and the last one you mentioned, what do those
medic.
stand for? Yes.
Oh, sure. So CPFI stands for the Christian Pharmacists, CPF, International. Yes. So it's a group, it's a student organization that focuses on like fostering Christianity within pharmacy. And so that was really the heart of our weekly meetings, was like, how can we keep our Christianity and our like love of Christ, how can we like express that as a daily, in our daily lives as pharmacy students and as pharmacists.
Sure.
MEDIC stands for, I'm not sure what it stands for, but it's a group of student-run free clinics, and it's a pretty extensive, impressive network of free clinics that's completely student-run. And there's multiple clinics all over the city of Madison, and they each kind of serve their niche population. And so you have medical students that are in charge of each particular clinic, but then pharmacy is involved as referrals coordinators. We help run the actual free medications that we supply to those clinics. And then you can serve as a volunteer to do like patient interviews and patient assessments. And then there are doctors and nurses that volunteer their time to help staff those clinics as well.
Absolutely. And it's a very hands-on and practical experience, because you're interacting with everyone on the healthcare team that you'll be working with in the future.
Exactly, yes.
Prepares you very well for residency.
Yes,
sure.
yes, it does, yeah. There are still students, like medical students that I worked very closely with during my medic experience, that now I see them in the hospital and they're on fourth year rotation, and we sit and we talk and they're like, oh, you're a real pharmacist now. And, but it's just nice because you know them and you've worked with them, and now you get to take care of patients together in the hospital, so it's a really neat experience.
Absolutely, very rewarding.
Yes.
So what led you to choose clinical pharmacy as a career path for you, and knowing that you want to go into pharmacy residency?
Sure. So for me, it was a little bit of, I guess, just serendipity. I mean, when I had that first shadowing opportunity when I was a junior in college, I just happened to shadow a hospital pharmacist. At that point, I don't think I even understood really the difference between hospital pharmacy and community pharmacy. But it was a family friend who was a pharmacist, and I found a time to shadow her. She just happened to work in a hospital, and I really liked what she did, so I kind of latched on to that idea. So going into pharmacy school, I had it in my head, like, I want to be a hospital pharmacist. But honestly, that was based on very little experience. And then I was exposed to different areas of pharmacies through the IB requirements during first year, and then I had an opportunity to apply for a technician job as an inpatient pharmacy technician at the VA, and I got that job. And then I was exposed to true, inpatient hospital pharmacy, and I liked what I saw. And then I was lucky enough to do the Valor internship program at the VA the summer after my second year, and that is a great experience because it gives you time in the outpatient world, the AmCare world, lots of experience in the clinics at the VA, but also time on the inpatient side. And I truly loved my ambulatory care experiences because you get to, see your own patients, manage their care, you staff with your recommendations with providers, but really as a pharmacist, you own that patient. But there was just something about my inpatient experience that I was like, yes, this is what I want to do.
Sold on it.
I was sold, yeah. And so then going into my third year, I knew I wanted to do inpatient clinical pharmacy, and that helped me choose the right rotations for fourth year. And, all of my experiences on the inpatient side just confirmed where I thought my interests were. So.
Very nice. It seems like one thing led to another, and
Exactly.
everything compounded on top of each other, and
Yes.
then you just knew when you went for it.
Yeah, that's exactly right.
So for people who might not know, what does a clinical pharmacy residency entail? How many hours a week do you work? What sort of time commitment is involved, and what sort of tasks do you do?
Sure. So I'll start out with the hours a week question first. So it's going to vary depending on which institution you're at. At UW Health, we have a fairly rigorous pharmacy residency program. So I would say I'm typically at the hospital about 80 hours a week. But you're not doing the same thing over and over every day. A lot of times I'm choosing to be there because I'm more productive when I work in my office. Thankfully, as residents, we have our own office space over there.
Very nice.
You know, with double screens, and you know, at home I just have a little laptop, so I'm much more productive when I'm at my office. So I choose to be there. So there are many days when I'm there from 6 in the morning till 9 at night, but usually I'm choosing to do that. Mm-hmm. And so I'll explain that a little bit more when I talk about the different things that you do as a clinical pharmacy resident. So sure. There's really like three main areas areas that I spend my time. So we have clinical rotations that we complete as pharmacy residents. We have a staffing requirement to the hospital, and then we work on various projects. So those are really how you spend your time as a resident. And for people who don't know what rotations are, you'll go on your rotations during fourth year, and that's when you're basically like an apprentice pharmacist. You're either in a pharmacy or you're up on the unit with the pharmacist and you're learning how to be a pharmacist. So that's what happens during your fourth year, and that continues as when you're a resident. So we have 12 different rotations that we'll do. Each are a month long, and the only difference from fourth year is that they're all within the same institution. So I'm doing 12 different rotations throughout my year. They're all at UW Health, but they're all in different clinical practice areas. So for example, I did a rotation in the neuro ICU for my first month. I did a rotation in the emergency department, and I did a rotation in our mixed medical surgical ICU. So when you're on rotation, because you're a licensed pharmacist, you can function as a pharmacist, but you also are a learner, and there's still a staff pharmacist on the unit. And so you guys can work as a team to kind of take care of the patients and do your daily activities. At UW Health, those activities include doing admission histories for patients, doing discharge counseling. You do a clinical profile review every day of all your patients, and you typically round with the medical team, and you serve as like a drug information resource and help the team make good decisions about which medications to choose for the patient. So that's what rotation is about. It's about learning, which is really awesome. And what's great about doing a clinical residency is that, you know, at no other time in your career do you get to experience all these different areas of pharmacy. You know, when I take my first job, you know, hopefully it will be in an ICU somewhere, since that's where my interests lie. But that's what I'll be. I'll be an ICU pharmacist. But for this year of residency, I get to do rotations all over the hospital. I just finished a transplant rotation. I'm going to do an oncology rotation. So you really come out a very well-rounded pharmacist, which is one of the advantages, I think, of doing a residency. I think I'm getting ahead of myself. But so rotation is a big part of what you do as a pharmacy resident. So then you also have a staffing requirement to the hospital, and that's really how they justify your salary. So at UW Health, we staff, it comes out to be about 12 hours per week, and that's in addition to, you know, your time on rotation. So it averages out to be, we work every other weekend and then one weekend or weeknight, like PM shift every 2 weeks. And so the difference between when you're staffing and between rotation is when you're staffing, you are the staff pharmacist. You don't have another pharmacist who's like helping you out. You're taking care of the patients for that unit. You are the pharmacist. And that's a very valuable experience, because when you're the one taking care of the patients, you have to make the decisions, you have to look things up, like everything relies on your shoulders. You're certainly well supported, and there's many people you can call if you have questions, but I always say that's where you really cut your teeth as a resident and you learn how to be a real pharmacist, is through that staffing requirement. Sure. So at a place like UW Health, you know, we have a pretty high staffing requirement. We staff more than most residents around the country. But I think we come out as like very confident pharmacists, and that happens. That confidence ramps up pretty quickly because you do staff a lot. And then lastly, you do various projects. You'll have your major project for the year, but you get involved, you know, in little things throughout the year. You know, if there's a new guideline that's being developed and you have an interest in that, you know, you can volunteer to help develop that guideline. Or we have a lot of order sets that we use in the hospital, and those come up for review, and I volunteered to review one of those order sets, making sure that it's like clinically appropriate, still up to date with current literature. So there's lots of different projects that you can get involved in as a resident. So that's how you spend your extra time. Very
nice. So you mentioned you spend about 80 hours a week, correct? Mm-hmm. Is that 12 hours of staffing in addition to those 80 hours, or is that inclusive?
That's inclusive. Yeah.
Okay. Mm-hmm. Okay, just making sure you're sleeping.
Oh, yeah. I do sleep, yes.
Good, good. And so you mentioned so many different components of your residency program. What skills do you think are the most important to succeed?
Sure, that's a really good question. So I think at the heart of a true, like a resident who's going to succeed is somebody who's willing to be a hard worker, because you are going to work very hard in residency. And so I think what I notice in a lot of my co-residents is that we like being at the hospital, and we like staffing. We like the fact that we put in a lot of time, because we come out of it so much better. And so I think if that's what truly drives you, like a desire to learn and a desire to become a better pharmacist, and you're willing to put in the time, I think that is like a true marker for success within residency. I think another marker for success, or another thing that are qualities you need to succeed, is I've lost my train of thought.
I can sing Jeopardy music until you think of something.
I think it's willing, or at the you have to have a strong desire to like help patients,
Sure.
Because that is what you spend so much of your time doing, and that's what's going to motivate you through those hard times, is being able to take good care of patients. And that's what I see in all of our great preceptors that we have at UW Health, is that they are just continually advocating for their patients. And that's what they're thinking about when they're doing their daily profiles reviews, like, are we keeping this patient safe? Are we giving them the best medications to make them better and to get them out of our hospital? So I think you need to have a true desire to take care of patients, because you're going to work hard, and you're going to sacrifice a lot, but it's ultimately to become a better pharmacist and to take good care of patients.
Absolutely. So having that baseline passion for not only taking care of patients, but spending that time and being really committed and motivated to follow things through and see things through to the very end.
Yes, I would agree.
Absolutely. Was there anything else you wanted to add on?
Nope, I think that's it.
Okay, excellent. So you mentioned that the staffing component of your pharmacy residency program is unique. What other components of your program make UW Health's pharmacy residency program very unique compared to other programs?
Sure. So yeah, the staffing requirement, I think, so not only in like the amount of time that we staff, but also the locations that we get to staff. So a lot of times you'll see at different residencies, especially at like large academic medical centers, a lot of time residents will be staffing in like their central pharmacy, or maybe they'll spend the first half of their year in the central pharmacy, and then they'll transition to being more decentralized on the floor. But at UW, we have 4 different staffing locations: cardiology, neurology, surgery, and I'm missing the last one. Neurology, cardiology, surgery, and general medicine.
Okay.
And within the cardiology unit, you can cover ICU patients. Within the neurology unit, you can cover ICU patients. And that is very rare for a first-year resident to, within their staffing location, be covering an ICU. And I guess for me, because I have an interest in critical care, that was something that I thought was just fantastic. And when I was interviewing at all different places last year, I was looking for that. Like, what do their residents get to do when they're staffing? And that is unique to our program. So the amount of hours, and then also where we get to staff. And the fact that we function as a staff pharmacist, you are the one taking care of your patients and doing their admission histories, their discharges. You own those patients when you're staffing. And yeah, I think that's unique to our program, and really helps develop us into competent pharmacists.
Absolutely. And another component of your residency program that you mentioned, and a component of many residency programs, is doing a residency project.
Yes.
Could you talk a little bit about your project and how you chose it, and kind of what steps you're going through to achieve the final outcome?
Sure. So I'll talk about how we chose it. So we get presented, or I guess I should back up, all of the pharmacists within the hospital, all of our preceptors, they compile ideas for pharmacy resident projects even before we show up. So they're creating that list like in May, and it's ideas that pharmacists within the hospital, things that they want to happen. So they submit all of their ideas, and then they have a big meeting where they really flesh out the projects. Like, is this a PGY1 project? Is this a PGY2 project? Or is this a project for like a 4th-year student? And they go through with like different criteria, and they grade each project. Like, is this feasible to be completed within a year? And do we have the right resources for this? And how much impact or how much change or how valuable is this project? And that's another great thing about our institution, is that they really take their pharmacy residency projects seriously. And because they go through this extensive vetting process, And it makes me feel better that whatever project is on that list, that's something that, like, there's already buy-in from the institution that they want it to happen, they want the change to happen, and it's an important change. And UW Health really uses its residents wisely to try to propel like new pharmacy programs forward or to make change happen within the institution. So they come up with ideas, they create a list, they have a meeting and really vet the list, and then they send it out to the residents, and we basically just get to choose from that list. So we get the list, we read over the projects, we meet with, because each project will have a project advisor, we can meet with that project advisor to kind of hear more about the project. Because sometimes you hear more details and you're like, oh, that's really not what I was thinking or not what I had in mind, and then you meet with another one and you're like, wow, that project sounds so much cooler than I thought, I want to choose that one. And then we go through and we kind of just choose our project as long as two people aren't interested in the same one, and usually you can make things work that somebody, if two people are interested in one project, like usually one wants another one a little bit more, so.
Okay, good.
Yeah, it all works out, because there's tons of projects on the list, so. And then once you choose it, you kind of, we get the blessing that everyone has chosen their project, and then you write up a draft like proposal of how you foresee you achieving that, and then you present that proposal to like the Residency Advisory Committee, and they give you feedback about if they think you should change anything in your plan. So that's kind of the process for how you get started. So to talk specifically about my project, so patients that come into the hospital are at risk for getting blood clots for like lots of different reasons, because they're immobile, or they have cancer, or they're very old, and we have objective screening tools that we use on patients to kind of score them to say how high is their risk for getting a blood clot. And, blood clots in the hospital, they're preventable, so when a patient gets one like that, it's not a good thing for the institution, it's not a good thing for the patient, it can cause a lot of complications and risks for the patient. And so that's such an important thing to try to prevent that the Centers for Medicaid and Medicare Services have created like CMS core measures around VTE, that's what we call it, VTE, venous thromboembolism, about VTE prevention. So every patient that comes into the hospital should be screened to see what is their risk for getting a VTE. And if they're considered to be high risk, we should give them something to help prevent them from getting a blood clot, either like an anticoagulant, or we put like mechanical squeezers on their legs. So that's the background. So, and we do a pretty good job at screening all of our patients within the hospital, but our documentation of that screening is not ideal. So my project is really looking at how do we improve the documentation of the fact that we are screening all of our patients, so that when we give these reports to CMS or the Centers for Medicare and Medicaid Services, that we're passing, because you need to achieve a certain level or a certain score, to be like qualified as an institution. And so that's what my project is, mostly changing the way that we document, because we're transitioning to pharmacist documentation, whereas before it was physician documentation. So we're hoping to improve our documentation and improve our CMS scores and improve, how we take care of patients and preventing blood clots. So.
Very good. It seems like a very valuable project that you're doing. It's going to have a huge impact on the institution.
I hope so, yes.
Absolutely. And what steps are you taking to achieve your outcome? You mentioned the project is kind of a multi-component project, so how do you go about it? What steps do you take? And
Sure. So it started, just meeting with my project advisor and brainstorming about, well, how do we want to change the documentation within the electronic medical record? And we came up with a couple ideas. Well, then, you have to get buy-in from your pharmacist, especially because this was going to be a change for the pharmacists in particular. So then we, presented it to we have specifically a pharmacist anticoagulation committee. So we presented it to them and got their feedback, what they thought, like, oh, well, we think we should document in this way. And so then we took that forward to then the pharmacy practice committee, which is kind of like a level up. Now it's a committee more of like managers and people who have more say in how change happens. And then we presented our idea to them, and then we got feedback from them. So then we got a clear idea, like an answer about how we want to change our documentation, and it involved building a new tool within the electronic medical record. So then we needed to get our IT pharmacists involved, because they help us build all of these tools that we use within the EMR. So then we had a meeting with the IT pharmacists, and we described to them what we needed to do, and they were able to take our vision and turn it into an actual tool within the electronic health record. So they build it in like a test environment, so then I was able to log in and kind of play around with it and give them suggestions like, oh, could we change this, could we change this? And then we had to educate our pharmacists about this change that was happening. So I presented at our staff meetings, and then I also went around to all of our individual team meetings in the hospital to kind of give all the pharmacists a heads up that this change was going to happen. And then the tool went live on February 1st, like 2 weeks ago. And I still was going around to individual pharmacists to get their feedback, and to the individual team meetings because I had lots of questions and people were emailing me. So now it's mostly this like communication phase where, you know, people find something like, oh, I think we could change it this way and this would make it a little bit better. And then, so I gather all that feedback and then I go back to our IT builders and I tell them like, hey, we need to change these few things to make it a little bit more easier for our pharmacists or more clear. So now we're kind of in the editing phase of the new tool. And then after it's been live for a month, we will run a series of reports to see if our documentation scores have improved at all from even January when our documentation was still in the old way.
I see. So this whole process, how long has it taken? What's been your timeline?
Well, my timeline was shortened a little bit because I had actually chosen a different project initially, and that project just, once we were diving more into it, we realized it was not a feasible project. So that was something that was stressful at the time, but looking back on it, like I'm so glad I changed projects and I'm so glad I had the support of the pharmacists around me to guide me like, well, maybe we should abandon this project idea. So I started a little bit late. I probably started like more in October, and typically you start working on your project more like in July. And so a lot of the soliciting ideas and feedback happened in October and November, and then the build of the tool happened more in December, and then editing the tool happened in January, and then the go live happened in February. And we'll probably be continuing to edit it and collect data up until April, which is when I'll go to like our Great Lakes presentation where we present our pharmacy or our residency year-long projects.
Very good. So that's the goal, is to start about in July or a little bit later depending on when you choose your project, and then finish by Great Lakes.
Yes, the idea is that the project is completed within your first year of residency. And if you stay on for a second year of residency, sometimes your project can kind of follow you. Because I can even tell with my project, there's like so many like other things that we could build into this to make it just super awesome. But at some point, you know, you do want to be able to conclude your project within a year. So that is the goal of choosing a project is, you know, is this a project that I want to be involved in? Is it important, and is it feasible for me to achieve it within a year?
Sure. So residency projects obviously are a lot of work. They take a lot of time and a lot of skills are involved. So how can students best prepare themselves for this type and level of a project?
Right, so that's a good question. I would say during fourth year, you will have the opportunity to have different projects, and a lot of them will be meant to be completed within just your 8-week or 6-week rotation. But now, more and more commonly, we have these residency track programs that students can participate in. So I participated in the APP-ERT, or the residency track program at UW during my 4th year. And one of the objectives of the residency track program is that you do get experience with like a longitudinal project. So although you still are completing projects within your individual rotations, you also have a year-long project. So that's one like very concrete way to get practice doing a year-long project, is to do one during your 4th year. But that being said, not everybody is going to do the residency track program. So I think another way to do that would be you could get involved with faculty members when you're a student in the School of Pharmacy. I feel like we were constantly getting emails about different research projects that faculty members were doing and that they wanted students to help with. And I think that's a good way to get exposure to, even if you're only working on a small part of the project, you're still exposed to that larger project, and you see like, you know, all of the different steps and people that it takes to get a project completed. I also think being involved in student organizations is a good way to just develop like communication skills, because so much of like residency projects, especially if it's about practice change in your institution, the success of that depends so much on your ability to communicate with other people. And a good way to get experience with that is being involved in student organizations, and not just being in a student organization, but taking on a leadership role. Like the different co-chairs that they have within the WSPS, or the Wisconsin Society of Pharmacy Students. For me particularly, I think my involvement in CPFI as a vice president and then as a president really honed those communication skills that are crucial in completing a PGY1 residency year-long project.
Good. And so you talked about continuing your project on into your second year.
Mm-hmm.
What are your current plans for your second year as a PGY2?
Yeah, so I early committed to a PGY2 in critical care, so I'll be staying on at UW for that program.
Very good.
Yes.
And what things do you consider when thinking about going for a PGY2? What kind of went through your mind in considering one and the different options?
Sure. So for me, I went into my fourth year thinking that I had an interest in critical care, and that was solidified with the rotations that I chose during my fourth year. And so I went into my PGY1 wanting to do a second year. And so that definitely influenced where I interviewed during my when I was interviewing for PGY1 programs, because I wanted to be at a place that offered a second year in critical care because I knew that was what I was interested in. And I also had a feeling that I would want to stay at the same institution for my second year. You don't have to. A lot of people will do 1 year and then move someplace else to do their second year residency. I think there's a huge advantage in staying at the same institution, and that's what I wanted. So it certainly influenced where I was interviewing, and when I was interviewing, like, I made sure to talk to the critical care pharmacist or the emergency department pharmacist during my interview day, and I made sure to be able to like tour those places. So I ended up staying at UW, and so the things that were going through my mind when I was, deciding whether or not I wanted to stay on for a PGY2, well, it's mostly like, in 5 years from now, where do I want to be practicing? And I wanted to be in an emergency department, or I want to be in an ICU. And well, then you think about, well, what kind of training do I need to get there? And at this point, to be a pharmacist in an ICU, as a new pharmacist coming out, it's kind of expected that you are trained as a PGY2 in critical care. And then that's certainly enough training also to get a job in an emergency department as well. And there are also emergency medicine second year residencies out there, and that crossed my mind as well, because I definitely see myself practicing in an emergency department. But for me, I decided, I love critical care, I love working in an ICU, I also love an emergency department. I think a PGY2 in critical care would prepare me for both of those areas, whereas a PGY2 in specifically emergency medicine, I don't think that would be as translatable to then working in an ICU, and it might be harder for me to get a job if I was just emergency medicine PGY2 trained.
Sure.
So those were the things going through my mind when I was thinking about PGY2s. And so yeah, just for my interest in where I wanted to practice, it seemed, one, what my interest was, and also what I needed to do to get to that spot eventually.
Absolutely. And UW Health has an early admittance program to get into a PGY2. So when did you find out that you were accepted, and what was the process like for you?
Sure. So it actually started fairly early. So I think we got an email from our program director in about late September saying, hey, I know it's really early, but if you think you're interested in a PGY2, just send that program director an email and CC me on it. And that's mostly so that they can get their recruitment budget figured out, because if a program director has already early committed to their program, then they don't need to go recruit at like a mid-year clinical meeting or anything. So that's why they kind of asked us to express interest so early. And then we had to submit a letter of intent, and that we submitted that like mid-October, I would say.
Okay.
And then they had a big meeting and they talked about us. And then we found out, so like the beginning of November, we found out whether or not we had been accepted to for our application for early commit to our PGY2.
Nice. That's a pretty fast turnaround, and I bet it gives you a lot of ease of mind just knowing, what's the plan for next year.
Yes, it was. And I think that's a huge advantage of our program, that they allow early commit and that they prefer to do early commit rather than going through the match process again. Because the match process, matching for residency, it takes a lot of time and it costs a lot of money. And so it's a huge advantage to be able to skip all that and to early commit to your institution. And it's easier for them, if you do a good job as a PGY1, they want to keep good people.
Right.
And so it's a huge advantage that they allow the early commit for both sides, for the residents and for the institution.
Absolutely. So win-win situation there.
Yeah.
So residency takes a lot of time, and it can be stressful at times as well. So what has been your motivation that's kept you moving on and really keeps you, inspired and motivated throughout the whole process?
Sure. I would say there are three main things that motivate me. One is just my desire to learn and to be like the best pharmacist that I can be. And that is incredibly motivating. And so even though you put in long days, at the end of every day, I remember particularly during my ICU rotation, so I was trying to do a fantastic job because I wanted to stay on for a PGY2 in critical care. In the ICU, you start very early because you round early and you need to monitor all your patients before rounds. So I would get there so early, and then on nights when I staff, I would leave the hospital so late, and I knew I would have to be back here so early, but I would leave the hospital with a smile on my face. And I remember thinking, like, Eileen, why are you smiling? It's so, like, you're tired and you have to be back here again. But it was because, like, I had learned so much that day, or on my night staffing, I was able to, like, really help out the doctors who were admitting a super sick patient late at night, and I was able to give them advice about like what anticoagulation they should order on the patient, and just like really fulfilling experiences where I would walk out thinking like, man, I was really a pharmacist today. And so that is incredibly motivating when you feel yourself learning and getting better, and when that's truly what you desire to just become a really good pharmacist. That's incredibly motivating. I also think like taking care of patients and having really good patient interactions is really motivating. I can't tell you how many times I was like having a stressful shift staffing, or I had a long day on rotation, and then and I had to work on something late at night. But, then in the afternoon I would have just a really fantastic patient interaction where I was like counseling like a new start warfarin on a patient, and they were just so grateful for the time that I had taken to explain everything with them. Or once it was a patient who had a woman who had just had a heart attack, and I was counseling her on all of her new medications after having an MI, and she hugged me after our counseling session because I took the time to like explain everything and to try to alleviate her fears. Right. And so that is incredibly motivating. No matter how long or hard your day is, when you like impact patient care in that way, like that will propel you through the rest of the week for sure, and through the weekend that you work. So, and then I would say lastly, motivating to me are my co-residents. We're incredibly supportive of one another, and I would like to say that it's just my co-residency class. There's 6 of us, and I think they're all awesome, but I feel like that's true in any residency program that you go into, because it is a hard thing that you're all experiencing together. And I think that's an advantage of our program, that there's 6 of us within our like PGY1 pharmacy practice class, but then we have lots of PGY2 residents, we have admin residents, so there's a lot of residents all together, and we're all incredibly supportive and motivating to one another.
Good. I'm glad you're so, inspired and just, driven to really impact patient care. I mean, that's what it comes down to. And they always say, I know APHA's slogan is, figure out what's your why. And, keeping that in the back of your mind at all times is really what's going to keep you going through the most difficult times. Otherwise, you're going to deal with burnout, you're going to deal with, lack of motivation, and maybe not be inspired to help patients in that way anymore. So, good. Yes. So we can't always spend our time in the clinics and hospitals. As you know, we might go a little bit crazy. So how do you spend your time outside of pharmacy school? How do you keep everything balanced in that way?
Sure.
I'm sorry, not pharmacy school, pharmacy residency.
Oh, yeah. Didn't even notice. So I have family somewhat close by. My parents still live in Green Bay. My sister and brother-in-law and 2 little nieces live in Baraboo, which is not far away. So I'm pretty intentional with my time off. Like I said, we work every other weekend, so I'm usually spending time with my nieces on my weekends off. And I think that that's important, to be intentional with your time off, and not just, going home and vegging, but having like really, sometimes you need to go home and veg, but having like quality time, and making time. Like I put time on my calendar to spend with my like non-pharmacy friends. I have a good group of girlfriends in Madison that are entirely not related to healthcare at all, and it's like the most refreshing thing to just go. We're gonna have a spa day like in 2 weekends, yeah, and we won't talk about pharmacy at all because we're gonna talk about The Bachelor and shopping, and it's gonna be wonderful. So I think that's important. So that's how I spend my time. Yeah, spending time with family, spending time with friends. I also really like to run. I think it's helpful if you do like to work out to try to maintain that as much as you can during residency, because I know for me it's a stress reliever. It just helps me feel like a normal person when I'm getting my regular runs in. And then as far as like other kind of free time, we have started a mentorship program with the School of Pharmacy, and so we try to like reach out. I helped with like mock interviews. I have a mentor, and we've met a couple of times. So I try to do time or spend personal time like just doing personal things, but then also I feel like we do have enough time to kind of give back and get involved with the School of Pharmacy in that way.
Good. I'm glad you're being so intentional about your time off, because I feel like if we aren't, then it's so easy to just kind of see the hours roll past and nothing gets accomplished, and you're kind of just,
all of a sudden you're back at the hospital.
Yeah,
and you're like, what
exactly.
did I do with my weekend off?
Exactly. So I like the idea of, scheduling that time off, and what you're going to do with that time is really important. So if you could go back to your first year of pharmacy school, I know it's a long time ago, but think back, what would you do differently, if anything?
Yeah, this was a hard question for me it's a hard question for me to answer, because I wouldn't change too much, but I think one thing that I would probably change would be the amount of networking I did, and not really networking with like pharmacists in the area, but more networking within the School of Pharmacy.
Sure.
I wasn't super social throughout my years in pharmacy school. I worked a lot. I was much older than a lot of my classmates, and I think that, made me less, or try to be less social, I think.
Sure.
And so I think going back, I would probably try to network a little bit more, both within my class, but also with the upperclassmen. And, I realize it now as a resident, like the pharmacy world is so small, and if you have a connection, at another hospital, that is so helpful when you are, like when we're interviewing a candidate, and another pharmacist who is a UW graduate has worked with that student, you can call them up and say like, oh, do you have any insight in this student? Or if you are trying to help somebody get a job, you can call up your friend from pharmacy school who's now working in Montana, you can help make those connections. And I realized that when I was interviewing for a residency that there's UW students everywhere, because UW is a very strong program, and we tend to send our students out to like really great residency programs all over the country. And so it's important when you're a student, even when you're a first year, like making those connections with second years, third years, and keeping up those connections. And so I think that's one thing I would try to do a little bit more of if I were to go back to first year.
Good. And what would you encourage students to do throughout any of their years in pharmacy school to best prepare themselves for a pharmacy residency?
Sure. So I think it is important to get pharmacy experience in the work setting. And so sometimes that can be hard to do. Sometimes it can be hard to find a pharmacy job, but I would encourage students to try to seek out those opportunities, even if it's working as a technician at Walgreens, or working in a long-term care facility, or working as an inpatient pharmacy technician. I think any pharmacy experience that you can get, like really hands-on working experience, is very valuable. And it looks really great on a resume. And I know a lot of residency programs, when they're going through these applications, they like to see pharmacy work experience. And the earlier you can get started with that, the better, because a lot of times you can transition from technician roles into intern roles. So I would encourage students to try to work. And it seems intimidating when you start first year, like, oh, I don't know if I can do first year and do a job. But I think it's a good experience also in time management. And, you can certainly work a limited number of hours and slowly ramp up as you become more comfortable. But I think it's a really valuable experience. Plus, it provides you with mentors at whatever site you're at, and provides you with pharmacy connections within the state of Wisconsin, which is always beneficial when you're trying to get a job or trying to get a residency. I would also encourage students to, and this sounds like very cliche, but to study hard and to really get the most out of your classes. I can't tell you how many times on fourth year rotation I pulled out a piece of information from my brain that I had learned, from studying Casey Gallamore's lecture notes from pharmacotherapy during second year. And it's just really rewarding to be on rotation and to know things, to be able to answer questions of the physicians, of the medical students that you're working with, because you studied hard. And I think it's easy when you transition from undergrad to pharmacy school to kind of have that same mentality, like, I just got to make it through this test. I just got to get this information in my brain, get the A and move on. But that is not how you should approach pharmacy school. The material you're learning in pharmacy school is what's going to build your foundation to be a good clinical pharmacist. And so I think it's important to take it seriously, especially like your pharmacotherapy course, your pharmacotherapy lab. Like, take those courses seriously, invest a lot of time into them because you will get so much out of them. And it won't be a waste of time. You will be able to shine on rotation.
Those are a lot of great points. In general, just what are your final words of advice for students thinking about pharmacy residency and clinical pharmacy? What sort of things do you want to leave them with to start thinking about?
Sure. So I think I have two things. The first one would be to get involved in school, but get involved smartly. So it's very, and on the first day of pharmacy school, you walk in and all you hear is, get involved, get involved.
Right.
You need to have a stacked resume. It's so hard to get into residency now, so you need to be involved. But I would challenge students to find something that they're passionate about and become involved in that thing, but become very involved, take on a leadership position within that organization. You had mentioned earlier that, you were so involved. I feel like I wasn't involved in as many organizations as many of my peers, but the organizations that I was involved in, I was deeply involved in them. Right. And so that pays off for a couple of reasons. One, if you're involved in things that you care about, it doesn't matter how much time you're spending on them because you want to be doing it, you're passionate about it, and it makes balancing school and work and extracurricular so much easier when it's something that you're doing, because you love it and not because you just want to be involved.
Right.
And then also, it makes it easier when you are applying for when you're interviewing for jobs, for internships, for residencies. When you get asked questions about those organizations that you're involved in, you have good stories to tell because you were truly involved and maybe you impacted how the organization did a new project or something. But if you're only peripherally involved in many organizations, that's people will see through that on interviews. So I challenge you to get involved, but to get involved intentionally and smartly. My other piece of advice would be if you're thinking about a pharmacy residency, I think we talked a lot about like the rotations and becoming a better clinical pharmacist, but a huge part of residency is making you a well-rounded pharmacist in the idea of leadership as well, and also as a future preceptor. So when you come out of residency, you want to be strong clinically, but you have so many opportunities within pharmacy residency to get exposed to leadership within pharmacy. And so I think that needs to be something that you are willing to do or that you want, because that's a lot of what residency is about.
Absolutely. And I think that's something our profession needs right now is pharmacy leaders to really progress our profession forward and advance it and really get recognition from other healthcare providers and just the public to understand, what pharmacists are really doing and what kind of impacts they're making on patient care.
Yes, I agree.
So we really need those advocates for our profession, absolutely.
Thanks.
So thank you so much for spending the time and talking with me. I know your advice, your very thorough advice, was excellent. I enjoyed hearing all about your program, all about your projects that you're leading, how you chose your PGY2. Everything was great. So thank you so much for your time and basically sharing all of your advice with us.
Certainly. It was my pleasure.
All right. Thank you so much.
Thank you.
Take care.